So I wanted to take some time explaining our firm system and our Assistant Chief of Service system because it's one of the unique aspects of our program that I think really helps create a personalized learning experience for all of our house staff. So each of our interns, when they join our program, joins a firm, and there are 4 firms within the Osler program. So if you think about it, if there are about 50 interns per class, that means there's about 12 or 13 interns per firm. And you stay with your firm throughout your residency. So if you join your firm in your intern year, you're in that firm as a second year, and you're also in that firm as a third year. And what does that mean practically for you from a clinical standpoint? So our interns spent about 5 months or so on the Osler Medical Service, which is our flagship clinical experience in the intern year. The Osler Medical Service is a general medical service that's made up of 4 teams, and each of our 4 teams is a firm. And so each team consists of an assistant chief of service who is the attending, 2 senior residents, and 4 interns. And they work together to take care of approximately 20 or so patients and are really a core unit. So if you think about it, if you have about 12 interns in a firm who are each doing 5 months on the Osler Medical Service, and there's about 4 of them at a time, that means you get to work with the same people multiple times throughout the year, which allows you to form close relationships that will stay with you throughout your life. Also allows you to work with people who understand your clinical strengths, understands where you have room for growth, and can give you feedback and help you grow. Because we also have 2 senior residents on the service, and again, you have about 12 or 13 senior residents per firm, you might work with the same senior resident multiple times, which is again an incredible time for growth and learning as they help you move through the year. As I mentioned, each firm is led by an assistant chief of service, and these are similar to what our chief residents at other programs with a few differences. The big difference is that our ACSs are actually attending on their firm the majority of the year. So what does that mean? That means that interns get to work with the same attending throughout their intern year, and that allows for a lot of personalized growth and attention because that ACS understands your clinical skill set, they understand where your strengths are, they understand where your opportunities for growth are, and they can provide you with longitudinal mentorship, and that ends up resulting in a very personalized learning experience from a clinical skills building standpoint. Your ACS also tends to become a career mentor, a life coach, and a mentor overall. I speak with alumni frequently who will talk about their ACSs and how they've reached out to them with a question or wanted to get their opinion on something. And these are folks who might have graduated 20 to 30 years ago, and they still have experiences that link them to their ACS, and they still have a lifelong relationship with their ACS. So it really is a wonderful way to develop a longitudinal learning experience, but also a longitudinal relationship that really continues with you throughout the rest of your career. We also have a wonderful aspect of the firms called the firm faculty. So each firm has faculty who are assigned to the firm, and those faculty will attend a monthly firm grand rounds. They'll give teaching sessions for the firm residents, and they'll also attend social events for the firms, or maybe even host some social events. So what that means is, again, you're creating sort of a small family within our overall Osler family, which is wonderful for peer mentorship. It's wonderful developing mentors outside of the folks that you're working with on a day-to-day basis. And again, creates a small, close-knit environment that allows you to thrive and grow.